Good afternoon, everyone. Welcome to Reach Center Online Seminars 2020 on Autism Management, Module 3. Before we start, just a reminder for everyone, kindly mute your mic in your line while the discussion of the seminar is ongoing. If you have any questions or queries, just click the wave hand in the chat box below or simply type your questions in the chat box. For the disclaimer, the information provided by me on this seminar is for general, informational, and educational purposes only. All information and my presentation are only based on my research provided in good faith. However, I am not an expert when it comes to medical field, and we make no representations of any kind, express or implied, regarding the accuracy, adequacy, validity, reliability, availability, or completeness of any information on this presentation. I will use English as the medium for this discussion because some of our participants are from outside Cebu, and I will also use some simplified terms for the sake of everyone. So just sit back there, listen, and relax. So how are you? I hope you'll fine throughout this pandemic, so as your kids. I am here in front of you virtually to discuss the topic autism, overcoming challenges during COVID-19 pandemic. To start with, we assert that individuals with autism are an important group who might require additional support during the COVID-19 outbreak and future public health emergencies. I will be tackling common challenges that individuals with autism and their families encountered currently. I will mention later some effective strategies that would greatly help those challenges. So here it is. At the end of the seminar, we aim to first, define and discuss the challenges that the children with autism face in this COVID-19 pandemic. Second, enumerate and discuss the corresponding coping strategies in overcoming the challenges in COVID-19 pandemic. Lastly, have parents debriefing with regards to their child's frustration due to the changes brought by the COVID-19 pandemic. But before anything else, let us meet and define the terms to be mentioned here. So first, what is the word autism? Autism is a lifelong developmental disability that affects how a person communicates with and relates to other people. It also affects how they make sense of the world around them. Autism is a spectrum, which means that while all people with autism share certain difficulties, their conditions will affect them in different ways. So autism is composed with the dyad of impairment. We have the social communication and behavior. Next, what is a COVID-19 pandemic? COVID-19 pandemic is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. It is a new strain of virus first detected in Wuhan, China, 2019. So COVID-19 pandemic is the current situation that we have right now worldwide. All people living in this world is affected by COVID-19 pandemic. So in connection with the two defined terms, at a time when everyone is stressed about contracting COVID-19 outbreak, becoming better educated about how to manage Patients with autism will increase patient and thus can provide safety while appropriately helping them and their families. Today, I will be discussing the common challenges that individuals with autism encounter, especially when they are admitted to the hospitals during this time. So I must say that the overall health system can better anticipate and meet the needs of these particular patients if they knew their conditions in the first place. So, here are the challenges of individual with autism encounter during this COVID-19 pandemic. First, according to the Centers for Disease Control and Prevention, or CDC, individuals with autism are at higher risk for COVID-19 complications. This is because they tend to have immune disorders and other comorbidities. When we say comorbidities, it says that existing simultaneously with and usually independently of another condition. So it means that there are possibilities that your child is diagnosed with ASD, morbid with OCD, or it can be your child is diagnosed with ASD, comorbid with another medical conditions like having seizures. Next, the process of isolating can be very hard on individuals with autism and their families. So this is according to one of my references, Dr. Isra J. We all know that person with autism cannot adapt easily to any changes. In this time of pandemic, everyone was advised to stay at home, and one of them are the person with autism. Staying at home might be very difficult to them, especially when they are used to go different places every day. Third, person with autism and their families are likely experiencing heightened stress during this time. If person with autism need medical care, their situation often becomes more overwhelming than usual. So this is again according to one of my references, Dr. Isra Jane. At this time, everyone was experiencing heightened stress, right? So this is caused by the pandemic, so as the individual with autism and their families. When individual with autism needs to be hospitalized, their respective families become more overwhelmed. For individual with autism gets sick, they react differently than a normal person does. Next, the healthcare environment, especially in the emergency room, can be difficult and overstimulating for a person with autism, possibly due of the crowd, sounds, and lights. Since person with autism has sensory issues, the parents should let the hospital staff know about their child's situation to avoid the unnecessary manifestations of bad behavior, and in order for them to modify the said environment. Fifth, parents are not allowed into the ER exam and hospital rooms during the pandemic. We are all aware that when someone is hospitalized nowadays, no one is allowed to take good care of the patient aside from the hospital nurse and doctor. In cases like this, when person with autism will be hospitalized, the parents are advised just to wait in their respective homes. Sixth, if the individual with autism patient is running around the ER waiting room, the child is overwhelmed because of the environment. So some people would say that if the children who is or if the patient is running around the ER waiting room, for example, it is not because the parents don't know how to discipline the child. Instead, they are just overwhelmed because the place is new to them. Another factor could be the crowd, the sounds, and the lights. So the environment would be a big factor. 7. Because of the COVID-19 pandemic, many businesses providing care or specialized educational programs have closed across the world, either voluntarily or because of mandates. These closures mean that individuals with autism spectrum disorder are receiving fewer, if any, crucial therapy hours like speech and OT therapy, and most importantly, the classroom time than they normally would. So some parents who had children with autism and is enrolled in the Reach Center would frequently ask us about when we'll be going back face-to-face classes. So this is a big challenge for us in this time of pandemic to consistently follow up the kids to avoid any regressions. 8. Radically altered routines. When the pandemic came in, everyone was advised to stay at home, so as the people with autism. From their usual routine like home, school, mall, to just staying inside the house, it is indeed very difficult for them. 9. Difficulty comprehending the situation and expressing themselves. Depending on where they are on the spectrum, from extremely high to low functioning individual with autism patients might have challenges in comprehending the situation. So if you try to explain them the current situation verbally, they cannot understand it easily since person with autism is a visual learner. Giving a verbal instructions can be a great challenge for the parents. 10. They don't have a concept of waiting of their turn. As we all know, individual with autism does not know the concept of waiting, right? Especially in a new place that is very overwhelming and overstimulating. Person with autism lacks in understanding the concept of waiting, most especially the kids. They would continuously do what they like to do in a certain place, but if it is in the emergency room or emergency waiting room, you must be patient enough in making them busy to avoid resistance behavior. 11. At a time when it is important to wear a mask, individual with autism might refuse or take off their mask because of sensitivity issue. There are some individual with autism who had an extreme sensitivity issue, just like in wearing a mask. They cannot tolerate it in a long duration of time because of its texture, especially when it gets attached on the skin or in their face. Lastly, last challenge would be individual with autism might have challenges with communicating their needs and wants, hyperactivity, and behavioral issues. From the start of the lockdowns, individual with autism's routines was radically altered into one, which is by staying at home. They might not be able to communicate well, especially for the nonverbal ones, about what they feel and when they need something. Some parents would likely to struggle about their child's hyperactivity and how to redirect it into an appropriate manner at home. And the other kids may manifest behavioral issues like attention seeking, avoidance, and many more because they can't easily adapt on what is happening right now, or they become overstimulated staying at home. So, since we already knew the common challenges encountered by individual with autism, now the question would be, what are the strategies in overcoming these challenges? How do we accommodate our children with autism loved ones during a pandemic like this in ways that respect their needs and their style of managing stress? So here is what we are trying to do. First, always be patient. If you need time to adjust to the limits and demands of sheltering in place, your children with autism loved ones need even more time. Do not expect them to immediately take to new routines, such as online learning or being housebound. Make their new routines as engaging on their terms as possible. Understand that some matters, such as wearing a mask, may never be possible for sensory reasons. And lastly, find a way using whatever communication style that works best for your child, like asking, "Are you ready for the next activity or transition?" So it often takes a child with autism spectrum disorder longer to process information. You may need to slow down your conversation to his or her speed. Next, provide structures like visual schedules. Individual with autism is very keen of routines. Be predictable and reliable. Make sure that you adhere to that schedule and explain any changes before they happen if possible. So just like when we are having a daily program in Reach Center, the students are provided with visual schedules, just like what can you see here in the illustration there. Their to-do list in that day, and before we start our class, the students will have a prediction with what they're going to do in that certain day. We also encourage using visual cues in your respective homes at this time of pandemic, like using pictures, especially for the nonverbal individual with autism, in order for them to comprehend easily. Next, so I have another example here. Right now, we have the home-based learning program of the Scholars Enrich Center. So as you can see in the picture, the child is guided here. He is guided by the PEX or the picture exchange card system provided by the parents. So here it is, study time. So there is also an illustration with what is the weather for today so that the child would easily understand. So here it is very visual. Next, maintain a calm and empathetic manner. At the middle of this crisis, it is very important to maintain a calm and empathetic manner so your child doesn't inactively take on and amplify any difficult emotions that you may be dealing with yourself. as people with autism are wont to do. You both may need more space than usual, and that's okay in a crisis like this. So always maintain a calm and empathetic manner. Fourth, let your child stim. Let your child stim like rocking, hand flapping, or hand flicking as long as they are self-regulating and not hurting themselves. Always try to understand that your children with autism take on self-soothing. Fifth, be mindful of your child's social disposition. Some individuals with autism are introverts and they are content to stay at home or find their anxiety eases in the absence of unpredictable social dynamics. But many others are also extroverts who miss their social lives keenly. In this time also, always be aware on your child's social disposition or circle of friends to avoid the spread of the virus. 6. Make sure your child gets physical activity, especially if the child is energetic. Any exercise or movement is very good. Physical activity is crucial to many individuals with autism's ability in order for them to self-regulate. Let them play at home, even just for 20 to 30 minutes. So it is the best therapy for those children who is very hyper or who have hyperactivity. 7. Watch for subtle signs of sickness. Be aware that children with autism always perceive or they cannot perceive or express feeling ill and regardless may not behave like a typical sick person. Some kids will implode when sick, some will keep on as though they are not sick at all, and in some cases, children with autism who have fever will be more engaged and self-regulated than usual. It may help to establish your child's baseline temperature and it's very important to monitor it daily. 8. When individual with autism overstimulate, it's important to reduce the child's stress. When you are inside the hospital room, like emergency room, inform the doctor right away or inform the doctor who is in charge and make a request to make an adjustment since the patient is individual with autism. Reducing the child's stress is by making the room calming and comforting. When at home, when individual with autism overstimulate, give them time to self-regulate or let them stim and for just 20 to 30 seconds. 9. Individual with autism patients need their parents inside the ER to help keep them calm and facilitate communication with providers. If in times that your child is admitted to the hospital, kindly inform the doctors that having their parents or guardians inside the room would really minimize the occurrence of disruptive and unnecessary behavior. Parents had credible power to identify what are the needs and wants of their child. They also have cues, which they are the only one who can understand their child's behavior. 10. It is better to keep them wait in an exam room rather than keeping them in the waiting room. The ambience of the exam room is more comfortable than ER room. Instead of letting them wait in the ER room, why not in the exam room that could help reduce the child's stress. 11. If the individual with autism patient keeps taking off his or her mask inside the hospital, provide the individual with autism with additional masks to keep them safe. The hospital staff must be informed right away that the children with autism patients have sensitivity issues when it comes to wearing a mask. In order for them to keep safe, the hospital staff must give additional masks to the child for security. So if ever, in some cases, the hospitals don't have enough stocks, it would be wonderful if the respective parents prepared and bring more masks or DIY masks that can be tolerated by their child. So last strategy would be telehealth can also be a viable and promising solution. It develops services that geared specifically towards individuals with autism. So what is a telehealth, by the way? Telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and clinician contact, care, advice, reminders, education, intervention, monitoring, and remote missions. So just like here in Reach Center, we also cater online consultation or home-based program for the continuity of the child's early intervention in adapting the new normal due to the COVID-19 pandemic. If available and when possible, we encourage families to seek out timely, high-quality early intervention therapy for autism and medical services via telehealth for their relatives with ASD, because many individuals with autism show an affinity for electronics. Telehealth might be an effective tool for teaching and therapy with the proper support in place to enhance accessibility. So now, let's have a recap. These are the challenges that I've mentioned earlier. Individuals with autism are at higher risk for COVID-19 complications. Isolation process can be hard on individuals with autism and their families. Individuals with autism and their families are experiencing stress during this time. Emergency room overstimulate individual with autism. Parents are not allowed into many ER and hospital rooms. The child is overwhelmed in the ER waiting room. Another would be many specialized educational programs have closed. Radically altered routines, difficulty comprehending the situation and expressing themselves. Don't have the concept of waiting. Individual with autism might refuse take off their mask because of sensory issues. Lastly, they might have challenges with communicating, hyperactivity, and behavioral issues. So here are the strategies that I've mentioned earlier. Always be patient, provide visual structures, maintain a calm and empathetic manner, let your child stim, be mindful of your child's social disposition, make your child get physical activity, watch for subtle signs of sickness. It is important to reduce the child's stress. Individual with autism patients need their parents inside the ER. Let the child and the parent wait in an exam room. Provide children with additional masks to keep them safe. And lastly, telehealth develops services toward people with autism. Now, at this juncture, Allow me to take minutes to open the floor for the parents' mental health, psycho psychosocial support. So I and teacher Monique were one of the mental health responder online when the pandemic came in. So this parent sharing would serve as your outlet to open and share what you feel on handling children with autism at home in this time of pandemic. I encourage all the parents to join in the sharing. So I would love to if all the participants would be participating except for the teachers. So to start with, I have here an introduction. So I will introduce myself. Again, I am Teacher Zell, and I will be the one to facilitate in this session. So for the debriefing objective, to be able to let the participants share with regards their child's frustration due to the changes brought by COVID-19 pandemic. Risk and benefit of the session. The risk would be you will be having emotional and psychological discomfort, having a limited and unstable internet connection. By any chance, you will disappear in line. So let us be aware of it. The benefit would be having the feeling of relief after, having support from any other parents who had children with autism too, and the opportunity of dealing as your child's frustration amidst this time of pandemic. So we have limited confidentiality to other people, which means that whatever we talk in here about in this session will remain here. You are rest assured. Now let's start. At this moment, participants are asked to introduce yourselves, share how you are feeling right now, establish expectation for the debriefing or sharing. Thank you so much. Next, at this moment, participants are encouraged to share what did you experience about your child's frustration? What were the stresses or challenges with regards to your child's situation during pandemic? How do you adjust and cope with the circumstances? Thank you for sharing. At this moment, participants are facilitated to make a message to others who hurt, a message to others who support you, a message to your kids, and lastly, a message to self. Thank you so much. Next, at this moment, participants are facilitated to express what have you learned or realized from your challenges. What insight you have gained from your experience of support that you have right now. What meaning you find or what learning you've found. Thank you for sharing. Now let's move to the next slide. At this moment, participants are grounded and asked, how do you feel now? What can you say about the debriefing or sharing? Give message to co-participants. Thank you so much for your cooperating. So I will do the outro and closure. I am so glad that you were able to share with each other about your child's frustration during this pandemic. My hope is that when we emerge from this pandemic, may we continue to do a follow-up activities at our respective homes for the continuity of care for the person with autism who needs early intervention. With that, we need to better equip person with autism and their families to thrive together in the tough times and better ones. May our commentary begin to provide a framework for strategic enhancement and investment in therapy, education, and family support during future crises. I also hope that we will take advantage to our home-based program offered by our school in adapting the new normal. Please take note that there will be upcoming online seminars and don't forget to like our FB page, Parents Reach Foundation Incorporated, for more information. So, thank you so much for listening and participating. Do you have any questions?